Hello, I'm Shabab Haider from the BRAC James P. Grant School of Public Health. We'll be retrospectively analyzing evidence on the implementation of integrated health campaigns in the field of immunization in Bangladesh. We're aiming for a mixed method study, including literature review, survey, key informant interviews, and a focus group discussion. At the moment, we have completed the scoping review. From our scoping review, we identified health services that have been integrated with immunization in LMICs, including Bangladesh, and looked into the extent and outcomes of their integration. We also mapped out the challenges and enabling factors of integration, which can have potential implications for strengthening the primary healthcare system in Bangladesh. We targeted peer-reviewed articles in LMICs that have had at least one immunization component and were published before July 31st of this year. For our gray literature search, we included both Bangla and English literature. Our literature searches and screening process is displayed on this Prisma diagram. Currently, we have selected 31 articles, though we're still searching for additional gray literature. Our review yielded several key findings. First, the greatest number of studies in our review reported on the increased coverage that resulted from the integrations of services with national immunization campaigns. Programs such as Child Health Day in Sub-Saharan Africa or African Vaccination Week work to increase the coverage of vaccination, vitamin A, bed nets, and others. Services that have low acceptance and trust in the community, when coupled with services that were already widely accepted, can increase coverage for the former. This was seen when integrating MNCS services with the less accepted child polio vaccination in conflict-affected areas in Pakistan. Increasing cultural acceptance of health services is also related to maintaining the privacy of patients. In Cameroon, the integration of deworming, vitamin A, and HIV consultation allowed HIV-positive mothers to couple their health consultations with child health services that protected their privacy. Moreover, integration allows implementation to be carried out in a cost-effective way in remote areas. Shared staff, equipment, and logistics increase the feasibility of these programs. This outreach is also positively received within the community, and in many cases, it reduces the need for people to travel to larger population centers for treatment. Lastly, vitamin A supplementation turned out to be the most frequently integrated health intervention. Increased coverage was found in all explored studies. Vitamin A was shown to reduce child mortality at minimum cost when integrated with child immunization programs. Our review also yielded some common strategies for success when implementing an HIC. The most common successful strategy we found was using pre-existing infrastructure or healthcare programs. When the target population is diverse, the best method of implementation was using a mix of health posts such as schools, health facilities, and community vaccination centers. Not surprisingly, a school-based approach was most effective when targeting school-aged children and adolescents. Next, the community-directed approach uses community involvement in decision-making and service delivery to improve their sense of ownership of the project. Similarly, pairing novel or sensitive services with highly popular programs invariably leads to increased demand for the less popular one. Lastly, sharing HR was one of the most crucial strategies that made successful implementation possible. A workforce trained and supported by the community is an advantage when conducting a novel program. Apart from the cost-effectiveness dimension, integration within the same target population can remove redundancies in the health worker supervision, improve efficiency, and foster teamwork between service providers. Despite the clear benefits, our review also revealed hurdles to easy integration as well. There's an immediate cost to integration. Expansion of healthcare programs, even through the cost-effective process of integration, may not always be feasible for resource-strapped LMICs. Program organizers must be aware that funding is required to reap the benefits of a highly efficient healthcare program down the line. Despite the positive effects of HR discussed earlier, nearly every paper we examined cited HR as a major challenge or barrier. Several studies mention that integration would mean field staff would need to carry and manage more equipment than normal, which led to greater wear and tear and loss. Another common issue for staff is the additional workload for those who manage the equivalent of multiple projects as well, as for the staff who may not be properly trained for each of the integrated tasks. Despite the dearth of relevant published information regarding Bangladesh, our gray literature search yielded some significant findings. Integration of vitamin A and deworming achieved high coverage. Supplementary immunization activities involving measles or MR vaccines were successful in increasing coverage, cold chain logistics, knowledge, and community acceptance of immunization through community mobilization. Challenges of the supplementary immunization activities were mostly due to vacancies in the workforce, lack of adequately skilled staff, and late disbursement of funding in difficult to reach areas. Our gray literature review found that currently no IHC is being conducted in the field of immunization other than a small scale emergency campaign in refugee camps that integrated MR polio vaccines and vitamin A supplementation. We will continue to look into new integrated health campaigns in Bangladesh. I'll conclude this presentation by going over some of the most promising practices we found from our scoping review. Involvement of the community builds a sense of ownership for the various healthcare programs. This is especially necessary for remote areas where acceptance of novel services is generally lower. Working with the community to build intervention also ensures that the community is receiving the most relevant interventions. As discussed earlier, field workers are the foundation upon which strong healthcare programs are built. Integration invariably increases the workload for an individual health worker. Additional training and support staff must be considered during the planning phase to ensure successful implementation. Integration is not a simple process, especially when considering larger nationwide programs. Many promising programs have never been implemented due to a lack of funding or political support. Lastly, the needs of the target population must be in mind when designing an intervention. For example, the implementation of child immunization and MNCH services could naturally be conducted in schools rather than health posts, which would improve coverage solely based on its convenience to both the mothers and their children.